Eczema. Video contents. What is eczema? Symptoms, causes and risk factors, diagnosis, treatment, prevention. Eczema is a skin disease caused by atopic dermatitis, as dermatitis, meaning dermatitis, and atopic, is related to hypersensitivity, allergy, which is, most often, due to hereditary causes. This type of eczema is most likely to occur after other symptoms that indicate the presence of allergies, such as asthma or hay fever, also called allergic rhinitis, hay fever, and weed asthma. Eczema generally causes skin irritation and itching, redness, and dryness to the point where cracks and scabs, crusts, appear on the skin. Eczema appears, in particular, on the face and limbs, but it can also appear on other areas of the body. Many people suffer from chronic eczema. Eczema is a very common phenomenon in children, but it often fades and disappears before they reach school age, 5 to 6 years. Symptoms of eczema. In most cases of eczema, itching appears before the rash appears. Eczema is usually accompanied by the following symptoms. Number 1. Patches on the skin that are itchy, dry, the skin in and around it is thicker than normal. It commonly appears on the hands, neck, face, and legs. In children, it may also appear on the inner side of the knee joints and the elbow joints. Number 2. Itching may lead to the appearance of wounds and ulcers covered by the scabs. Causes and risk factors of eczema. As with asthma, eczema is also a genetic phenomenon that is passed on from generation to generation. There is a specific set of genes, that lead to certain people having very sensitive skin, in particular, and certain social and environmental factors, such as psychological stress and others, can stimulate and provoke episodes of eczema. Eczema may be generated or exacerbated by exposure to stimulating agents available in daily used materials, such as Number 1. Wool and synthetic fabrics. Number 2. Soaps and other substances dry out the skin. Number 3. Heat and sweating. Number 4. Eczema may be exacerbated by dry skin. Since eczema may appear as a response to the body's response to stress and tension, any emotionally charged event, starting with moving to a new home and ending with diagnosing eczema. A pediatrician, dermatologist, or family doctor, who regularly treats the person concerned, can diagnose eczema. Due to the fact that many eczema sufferers also suffer from other allergies, the doctor may request hypersensitivity tests to identify and determine the factors that stimulate the eczema, provoke it and cause its appearance. These hypersensitivity tests are done, in most cases, in children with eczema. Achieving a new job can lead to the reappearance of eczema. Eczema treatment. The goal of treating eczema is to relieve or completely prevent itching, as persistent itching may lead to dermatitis. Number 1. Ointments and emulsions. Because eczema causes the skin to become dry and itchy, it is recommended to use various ointments and emulsions to moisturize the skin. It is preferable to apply these products to damp skin, for example after showering, in order to help the skin retain its moisture. Number 2. Cold compresses help relieve itching. Number 3. Over-the-counter products, such as ointments containing hydrocortisone, 1%, or ointments containing corticosteroids, which can be obtained by prescription, help reduce skin inflammation. Number 4. Medicines. In some severe cases, the doctor may prescribe medicines containing corticosteroids to be taken orally, by mouth. Number 5. Antibiotics. If an inflammatory infection appears in the affected area, the doctor may prescribe antibiotics to treat infections caused by germs, bacteria. Other treatments for eczema include anti-allergic treatment, antihistamines, that can relieve a lot of severe itching. Tar and charcoal-based treatment, to relieve itching. Phototherapy, exposing the skin to ultraviolet rays, phototherapy. Treatment with cyclosporin for people whose condition has not improved after treatment with other means. Prevention of eczema. Usually, eczema can be prevented or mitigated by taking one of the following simple measures. Use materials to maintain skin moisture. Avoid sharp changes in temperature or humidity. Avoid excessive sweating or overheating. Relieve stress and tension. Avoid exposure to materials that irritate it, such as wool or others. Avoid using certain types of soaps, detergents, or sharp solvents. Awareness and attention to the types of foods that cause eczema, then take care to avoid them.